Hello, I am Afid Ben Ahlima. I am a professor in cardiology and I'm the president of the National Tunisian College of Cardiology, and I am glad to discuss with my friend Walid Amara, who is the president of the French College of Cardiology, and we will discuss about AF. As you know that AF is an epidemiologic arrhythmia, and more than 30 million wild world have AF. Perhaps we can screen more. What do you think? Are there any studies presented in this edition of the European Society Congress regarding this issue?
Thank you for the invitation. It's always a pleasure to be with you. Of course, that has been addressed in one study. The name is Amalfi. This study is presented at ESC and is also published, and you can find the article freely on the JAMA review. What you find in this study, they sent without any contact with healthcare professionals. They do a randomized study, more than 5,000 patients, 65 years old and more. The majority, the medium age was 77 years old. One group, they didn't have any management, and the second group, they sent a Holter patch for 14 days. And their primary criteria is detection of atrial fibrillation. And what we find is that with this way, they increase detection of atrial fibrillation by 26%, and that was significant. Some comments. The first comment is that the majority of the events were found in the 3 first days. So maybe we can think that maybe in our practice, if you do 24 hours, if we do just an ECG, it may be good.
Yes.
So that's the first comment. And the second comment that you made, you increase atrial fibrillation detection, you increase anticoagulation prescription, but they didn't demonstrate reduction of stroke. The rate of stroke was not significant.
And what is the spectrum of the population which was screened for?
I think for us in our practice.
No, in this study. They screened high-risk patients?
Yes, SHATS-VASc score of 3 or 4 if these were women, more than 65 years old, classical risk factors. So the majority were 77 years old, which are high-risk patients.
Yes, okay.
So what I imagine, when my take-home message for the clinician, for the physician, is when you have patients with maybe a SHATS-VAR more than 2, if you are 75 years old, you should at minimum do an ECG. And at minimum do an evaluation of the different risk factors. And the higher is the risk factors, higher you have to think about screening. That's my message.
Okay. Then we thank you, and thank you for this discussion.